My name is Octavia Sherrill, and I'm going to demonstrate how to do an IV insertion. First, you want to get all your materials together and everything, and before you do all that, you want to verify the physician orders, and you want to, for the infusion, for the saline lock. Also, you want to identify the patient. So you want 2 forms of IDs. You're going to ask them for their name and date of birth. You also want to check their bracelet and make sure the information is correct. After that, you want to ask them if they're allergic to anything, any medications like Lasix. Are they allergic to tape, any chlorhexidine or iodine? Next, you want to make sure any trauma that they might have had that might indicate or have an issue with the site, like if they had any mastectomy. I think I said that wrong, but yeah. And also any history of dialysis access for a site, any trauma and prior history of any basal drainage. After that, you want to perform some hand hygiene. Then you want to get your tourniquet, and you want your tourniquet to be 4 to 6 centimeters. Then you're gonna fix the tourniquet, and then you want to place 2 fingers to make sure it's at length site, make sure it's secure. After that, you want to prepare your chlorhexidine. I'm going to use the chlorhexidine, but I also want to make sure I check my radial pulse before I do anything. It's good. After that, I'm going to prepare my chlorhexidine cleansing, and I'll take this out. And then I'm gonna put my gloves. So I'm going to use the Doris venous vein. So I'm going to rub my chlorhexidine first. I'm going to rub it and for 30 seconds. Then while I'm letting that dry, I'm going to anchor. I'm going to do my sodium chloride, and I want to get the air out in the bubbles. So that's what I'm going to do first, and then I'm going to attach it to my tubing. And I'm going to prime it. And then I'm going to put that back in a secure container so it won't stay sterile. Once I do that, I'm going to anchor my hand. And before I anchor though, I need to get my needle out. And my gauge I'm using right now is a 20 gauge. So I'm gonna take the top off. The bevel needs to be up, and I'm going to anchor my hand. Before that, I'm gonna twist it a little loose. Then I'm going to go to 10 to 30. then I'm gonna hold with my dominant finger, and I'm gonna untwist it. And I'm gonna place this in the sharps. And while I'm holding that, I'm going to let go of my tourniquet, release my tourniquet. And then I'm going to make sure it was blood flow, flush, what is that? Backflow prior, before letting loose of the tourniquet. Then I'll let the tourniquet go. Then I'll put this lovely sodium chloride, attach that. And I'm going to go to 2 to 3 cc's in flushing. Okay. Once I did that, I'm going to release this. I'm going to keep my hand steady on that because I'm going to apply a little pressure. I don't want that to move. I'm gonna place this right here. I'm gonna get my tape. I'm gonna apply some tape on the hub of the bubble, the hub, to secure it. And then I'm gonna put my transparent dressing on this insertion site. I got it. Voila. I'll place it on the insertion site. Alright, once that's secure, I'm gonna also put some tape on tubing. Does that like me? Okay. Okay. And I'm gonna take this piece off. Okay. That is on there. All right. Once everything is secure, I'm going to remove my gloves, discard everything in the sharps container, make sure I put everything in the sharps container, document my IV starting on the patient, medical record, include the date and time on IV, and make sure the gauge, document the gauge number and attempts of the vein site on the IV solution, rate of the solution flush, and patient's response. After everything is done, that is it.